Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Each year, hundreds and thousands of women lose their lives to cervical cancer. Yet many do not know that this disease is highly preventable with measures such as screening or vaccination. With me in the studio are Doctors Mugisha Moses and Dr. Musinguzi Daisy to help us understand this big monster that seems to be killing many Ugandan women, this monster called cervical cancer. You're most welcome, doctors, to the show.
Thank you.
And you are watching the DocTalk show. I'm your host, Dr. Darius Owachi. So let's get down to business to understanding what cervical cancer is and how it can be prevented. So, Dr. Daisy, you in your field, you interact a lot. By virtue of your specialty, you deal with women's health. And cervical cancer, when people talk of cervical cancer, it rings so many bells because it causes so many deaths, causes so much misery in families. Help us understand what exactly cervical cancer is in the first place before we can dive into how to prevent it and all.
Yeah, the cervix is an entry and an exit into the uterus. Entry in reproduction, as in fertilization and the likes, and then exit during labor and delivery.
Okay. So
it is.
The cervix is part of the uterus.
Yes, it's
of the
part of the
woman's
uterus.
womb.
Yes.
It's the mouth or
The
what you say,
entry
the entry
and exit of the uterus.
of the uterus.
Yes.
So then, what is a cancer?
Cancer
Yes.
is like an abnormal division of cells. Okay. Normally, cells, yes, they undergo a life cycle. At the end of this life cycle, they're supposed to die. So now, cancer cells do not die; they continue to grow and become and are abnormal for that reason.
Okay.
And so
you're saying cancer cells or cancer per se is an abnormal growth of tissue.
Yes.
Okay, of some parts of the body. They're not. They grow beyond the size they're supposed to be.
Yes, they grow beyond what they should be.
What they should be.
Yes.
And in this case, cervical cancer is an abnormal growth within the cervix.
Yes, of the cells that line the cervix.
Of the cells that line the cervix. Right. It seems to be a very common disorder affecting so many women in Uganda, but fortunately our obstetricians in the studio are the best place to help understand more about this condition. So Dr. Mugisha, how common is cervical cancer?
Cervical cancer.
Oh yes, cervical cancer.
You alluded to it being a monster. I wouldn't really want to call it.
We think it's a monster because apparently many people die of this condition. So it seems it may get its credit for its name.
For that, I'll get to why I think it is a more friendly, a bit of cancer we can really foresee and prevent.
Okay.
So it used to be a very, very prevalent cancer worldwide. And we tend to see that in developed countries, it has really taken an upside turn. It is no longer as prevalent as it used to be in the 1960s, way earlier. And it used to be the most common, and it's now almost the 5th or 6th commonest cancer in the developed countries. So we're asking ourselves in the developing countries, sub-Saharan Africa, what is the problem? In Uganda currently, yes, it is the most leading cause of deaths, cancer deaths in our reproductive cancers in our women, and we are seeing what did these people do that we actually did not pick up with them and follow suit. The World Health Organization in 2016 says that we diagnosed close to 4,000 women, Ugandan women, with cervical cancer, and yet nearly half of these die within that very year. So you see, it is so lethal. The reason for that is really because we see it so late in the stages and cannot do so much. But prevalence-wise, we think we think the actual infective cause, as we shall later allude to, a virus called human papilloma virus, is very prevalent in our population.
Okay.
It's an infection, and we know this has been found and tested to be a causal factor for for this cancer, and 1 in every 3 girls have actually do have this HPV infection actively. So
Okay.
it is an infection we do get, and cumulatively in a lifetime of a lady, about 80% of women will actually get this infection. Of course, we are not putting the guns to the women; they are definitely getting it from the men. So it is just equally as prevalent in men as is in women.
Okay, so we'll slow down there. You said about 4,000 women were diagnosed with cervical cancer at some time, and within the same year we lost half of them. That is almost cause to worry. That's why we call it such a big monster. And you suggest that because we pick it late, that we get it when it's in its advanced stages. That's why we end up losing so many of our patients. So maybe in this show we shall now understand how best to catch it early and to treat and prevent it. Yes. But let's talk about this cause which you said, the human papilloma virus, the HPV.
I think
Dr.
that
Daisy,
is.
what exactly is that?
I think that's why he insists it is not the worst cancer. Okay? Because you see, with human papilloma virus (HPV), if you find it early, it can be treated. Okay, but most times these women, the reason why a large percentage of the women diagnosed in 2014, the 4,000, the reason why most of them died was because by the time they came, they were in an advanced stage of cancer.
Okay.
But generally speaking, if we find these women, if we set up a protocol to screen young women early enough, we can reduce the mortality.
By screening for the virus, you treat it.
Yes,
Then
the earlier you screen, the earlier, yes, you treat and prevent progression of disease.
So, so we have emphasized the point of prevention by screening. But how exactly is this virus caught anyway? Is it some kind of, do people, is it like a cholera when you eat bad food and then you get this virus? How is it transmitted?
HPV is a sexually transmitted virus. Okay.
Okay, just like these other, maybe syphilis or HIV.
Yes.
So
yes, similar mode of transmission.
Okay.
Okay. So what happens is this virus will invade the cells of the cervix and start to multiply there and cause changes on the lining of the cervix. And then, so what happens is when these women come and we screen, if you have gotten the infection, we can manage just that infection. But most of them tend to delay to seek help because it didn't come with symptoms. Like, it's not like the syphilis and gonorrhea where you come and there's a discharge or pain. Okay, this infection comes and you don't even know that you have it. That's why it's necessary to.
So that's why it's important to screen for it.
Yes.
So, very common is it only in women? Is it only women who get this infection?
If it's sexually transmitted, Darius, definitely they are getting it from somewhere. So
it can
it
also
is carried by both men and women. It's just that cervical cancer is caused by it in women.
And maybe that's why the bias of the discussion tends to focus on women. But we must remember that this infection, being sexually transmitted, can also be acquired by men. And the particular strains that cause the cervical cancer in women can cause cancers in men, more particularly cancers of the throat or of the genitals, or the penile or of the rectum. Okay, so remember you're watching the DocTalk show. You can always send your comments, feedback, questions to the social media platforms on Facebook and Twitter. We are discussing cervical cancer. Please don't go away. After the break, we're going to understand how one can tell that they have cervical cancer and what can be done to treat and prevent this condition.
You are watching the DocTalk show.